Most people think poor circulation is just cold hands and feet. They buy thicker socks, they drink more tea, they move on. But in my 20 years of practice, I've watched that small assumption cost people enormously, sometimes irreversibly. Because poor circulation isn't just a comfort issue, it's a communication issue. Your body is talking to you. And most people, including some physicians pressed for time, miss what it's actually saying. I'm Dr. Eleanor Hayes, an internal medicine physician, and after 20 years of treating patients just like you, I want to walk you through three specific warnings your body sends when blood circulation is dangerously low, warnings that are easy to dismiss, easy to misread, and absolutely worth knowing. Here's the framework I use with every patient I see. Signal versus noise. Our bodies are constantly generating information. The challenge isn't that the signals aren't there, it's that we've been taught to filter them out as normal aging. Today, I want to help you stop filtering because some of this NIDES is actually a signal you cannot afford to ignore. Let's get into it. Before we go further, if you're over 50, and especially if you have any history of high blood pressure, diabetes, or heart disease, please pay close attention. This one is for you. Warning number one, swelling that doesn't go away, especially in the lower legs and feet. Here's the thing about swelling. Most people chalk it up to a long day. Too much salt at dinner, sitting on a plane, standing too long. And sometimes that's exactly what it is. But there's a particular kind of swelling I've seen in patients, persistent, one-sided, or puffy in a way that leaves an indentation when you press it, that tells a very different story. This type of swelling can be a sign that blood isn't moving efficiently through the veins and returning back to the heart the way it should. Think of your circulatory system like a two-way highway. Arteries carry blood out, veins bring it home. When that return trip is sluggish, when the road is congested, fluid starts to leak out of the blood vessels and pool in the surrounding tissue. Why do people miss this? Because swelling feels benign. It doesn't hurt the way chest pain does. It doesn't alarm the way dizziness does. It just sits there. But here's what I want you to notice. Is the swelling worse at the end of the day and better in the morning after you've been lying down? That's a clue. Gravity plays a role. When you're horizontal, the fluid redistributes. When you're on your feet again, it returns. Now, and this is important, persistent leg swelling in someone over 50 can point to several underlying causes. Poor venous circulation is one, but it can also signal heart, kidney, or liver changes. That's precisely why it deserves a conversation with your doctor, not a shrug and another pair of compression socks ordered off the internet. I've had patients in their 60s who'd been living with gradual leg swelling for over a year. They assumed it was just getting older. When we finally investigated, we found circulation problems that were quietly progressing, problems we could absolutely address, but that had gone unmanaged for far too long. Your body was sending the signal. It just needed someone to listen. Stay with me, because warning number two is the one that surprises almost every patient I tell it to. Most people have experienced it and never once connected it to circulation. Warning number two, unusual fatigue after light physical activity. Let me ask you something. Do you get tired, genuinely disproportionately tired, after activity that didn't used to wear you out? Walking to the mailbox, climbing one flight of stairs, getting up to make breakfast. Fatigue is one of the most common complaints I hear in my practice, and it has a very long list of potential causes. Thyroid issues, sleep problems, anemia, medication side effects, the list goes on. But there's a specific quality of fatigue linked to poor circulation that I want to describe for you. It's a heaviness, a leadenness in the legs particularly. Sometimes it comes with a feeling of cramping or tightening in the calves or thighs during walking, which eases when you stop and rest, then returns when you start moving again. This pattern, discomfort during exertion that resolves with rest, is a classic sign that the muscles aren't receiving enough oxygenated blood to meet the demand you're placing on them. Here's what's happening underneath. Your muscles need oxygen delivered by blood to produce energy. When the arteries supplying those muscles are narrowed, blood flow simply can't keep up with demand during activity. The muscles essentially run out of fuel. They cramp, they fatigue, they protest. Why do people miss this? Because they assume it's just aging. I'm 65. Of course I get tired on the stairs. And yes, some decline in aerobic capacity is expected. But there's a meaningful difference between expected age-related change and a physiological warning that circulation is compromised. Here's what I tell my patients. If the fatigue is new, if it's worsening, or if it comes reliably with a specific level of activity and reliably resolves with rest. Write that down. That pattern is medically meaningful. And one more thing. Research suggests that circulation-related fatigue is underdiagnosed, particularly in women, where symptoms can present more subtly. Many people live with this for years without knowing, because the tiredness gets attributed to everything except what it actually is. If you're over 50 and this description resonates with you, this is a conversation worth having with your physician. The next warning is the one I almost didn't include because it sounds so ordinary. But it may be the most underestimated of the three. Don't click away. Warning number 3, skin changes, color, temperature, and texture. Your skin is, in a very real sense, a window into your circulation. And I don't mean that in some vague metaphorical way. I mean that the color, temperature, and texture of your skin, particularly on your legs, feet, and hands, can provide direct, observable evidence of how well blood is reaching those areas. Let me tell you what I watch for. Color changes. Skin that looks pale or bluish, especially in the toes or fingers, can indicate that blood flow to that area is reduced. There's also a purplish, mottled discoloration that can sometimes appear under the skin when circulation is sluggish. On the other hand, deep redness or a dusky color in a limb can also signal vascular compromise. Temperature differences. If one foot feels noticeably colder than the other, consistently, that asymmetry can mean that one side is receiving less blood flow. Your body is very good at telling you where the warmth is going. Cold extremities, particularly when combined with other symptoms, deserve attention. And then there's wound healing. This is the one I find most sobering in clinical practice. Poor circulation means poor oxygen delivery to tissue, and tissue that isn't well oxygenated does not heal well. A small cut on the foot or ankle that takes an unusually long time to heal, weeks instead of days, can be a sign that the blood supply to that area is significantly reduced. For people with diabetes in particular, this matters enormously. But even without diabetes, slow wound healing in the lower extremities is a flag I take seriously. Why do people dismiss skin changes? Because they don't hurt, because they look minor, because we're conditioned to think that if something doesn't feel urgent, it probably isn't. But I've seen patients whose first real warning, the one that led us to discover significant vascular disease, was a slow healing blister on the back of their heel. Your skin is not being dramatic, it's reporting accurately. Here's something most people don't fully appreciate. Poor circulation rarely announces itself loudly. It doesn't arrive with sirens. It moves slowly, quietly, and patiently, exactly the way we sometimes live with it. But here's what's genuinely encouraging. Circulation responds. The vascular system is not fixed. Research consistently shows that regular movement, even walking 20 to 30 minutes most days, meaningfully improves peripheral blood flow. Smoking cessation produces rapid and significant vascular benefits. Managing blood pressure and blood sugar protects vessel health at a fundamental level. The body wants to heal, it wants to circulate. It just needs the right conditions. What I tell my patients is this: the goal isn't to live in fear of these warnings. The goal is to recognize them early, when your options are widest and your outcomes are best. Before you go, here are 3 questions worth bringing to your next appointment, particularly if anything in this video felt familiar. 1. Is it worth checking my ankle brachial index? This is a simple, non-invasive test that compares blood pressure in your ankle to your arm and gives a clear picture of peripheral circulation. Many adults over 50 have never had it done. 2. Could my fatigue during walking be related to circulation rather than general fitness? This opens the door to a more targeted evaluation rather than a default response. 3. Are there any skin changes on my feet or legs that concern you? Ask your doctor to actually look. In a rushed visit, the feet often go unexamined. This question makes sure they don't. Your body is not subtle when it needs help. It is consistent, methodical, and if you know the language, remarkably clear. Swelling that lingers, fatigue that follows a pattern, skin that changes color, temperature, or refuses to heal. These are not simply the inconveniences of getting older. They are dispatches from a system that deserves your attention. You deserve that attention. If this video gave you something useful, I hope you'll subscribe. Every week I share research-backed health insights designed specifically for adults who want to age well, the kind of information that doesn't fit into a 10-minute appointment, but absolutely belongs in your hands. Take care of yourself, and I'll see you in the next one. This video is for educational purposes only and does not replace the advice, diagnosis, or treatment of your personal physician. If you are experiencing any of the symptoms discussed, please consult a qualified healthcare provider.